Have you ever looked in the mirror and felt that your face is not the same as before? One side of your mouth is slightly crooked. Your eyes can't close completely. Your smile is not as round as before. Those seemingly small signs can actually be an early warning from your nervous system. According to statistics, every year, hundreds of thousands of people suffer from problems related to the 7th cranial nerve, many of whom discover it too late, leaving behind long-term consequences such as facial paralysis, emotional disorders, and even depression. And what's worth mentioning is many people are subjective because they think one side of the face is numb, probably because of the wind. Don't let complacency cost you your smile and your face. The 7th cranial nerve is the nerve that controls facial expressions, and when it is damaged, not only does your appearance change, but your psychology and social interactions are also severely affected. In today's video, we'll show you the 7 earliest and most obvious signs that will help you recognize when the 7th cranial nerve is calling for help. Along with that, there are things you need to do immediately to protect the health and smile of yourself or your loved ones. But first, I want to tell you a story. A true story that has haunted me for months now. Don't forget to like and subscribe before listening. Evelyn is 71 years old this year. She used to be a literature teacher, a woman with a gentle smile and warm eyes. After her husband passed away, she lived alone in a small apartment on the 2nd floor of a retirement home in Seattle. One autumn morning, Evelyn woke up with a slight numbness on her left cheek. She thought she slept on her side, so she just stretched and made coffee like every day. But when she stood in front of the mirror to comb her hair, she realized that her smile was no longer intact. One side of her mouth drooped, and her left eye could not close completely. She did not tell anyone, partly because she was afraid of disturbing her children and grandchildren, and partly because she believed it must be the weather, it will be fine in a few days. But those few days stretched into weeks. The familiar expressions on Evelyn's face gradually faded. She no longer smiled brightly at the milkman every morning, no longer meticulously applied light makeup like before going to the market. Every time she drank water, she had to cover one side of her mouth with her hand because the water kept flowing out, as if her mouth no longer obeyed her. Her voice also changed, weak and distorted, to the point that she didn't want to call her daughter, for fear of sounding weird. Once someone who was always confident when talking and laughing, she began to avoid contact, avoid mirrors, avoid video calls with her little granddaughter, who used to love listening to her tell fairy tales. One afternoon, her daughter, Sarah, flew in from New York to visit. As soon as Evelyn opened the door, Sarah froze. One side of her mother's face was distorted. Her left eye was abnormally wide open. Her smile, which she had once considered the most beautiful thing in her childhood, was now distorted and lost. "Mom, how long has this been going on?" Sarah's voice choked. Evelyn just bowed her head, I thought. It was just fatigue. I didn't want to bother you. But when they arrived at the hospital, the doctor shook his head slightly. The damage to the 7th nerve had been too long. Permanent facial paralysis. There was no way to fully recover. Sarah held her mother's hand, her eyes filled with tears. In that moment, no one said anything. Only silent regret filled the room, regret for being silent for so long, for being subjective, for thinking it will all be over. And the smile that had been the symbol of Evelyn, the strong mother, the gentle grandmother, was now only half gone. A half that could not be restored by medicine, but could only be filled by love and companionship. This story is not uncommon. Every year, hundreds of thousands of people, especially the elderly, suffer from damage to the 7th cranial nerve. The problem is, many people find out too late. And when it's too late, the consequences are not only facial asymmetry, but also self-consciousness, depression, and loss of connection with loved ones. But you know what? The 7th cranial nerve is not silent when it is damaged. On the contrary, it speaks very clearly through early signs if we know how to listen. Because this is the nerve that controls almost all facial expressions, from smiling, speaking, frowning, blinking, to even the taste sensation on the tip of the tongue. So in the next part, we will go through the 7 earliest and clearest signs to help you recognize when the 7th nerve is calling for help. From there, you can intervene promptly, protect your smile, your emotions, and your complete connection with yourself and your loved ones. The 7th nerve controls almost all facial expressions, from smiling, speaking, frowning, blinking, to the taste sensation on the tip of the tongue. When damaged, it speaks very clearly if we know how to listen. Sign 1. Facial asymmetry, mouth distortion. When you smile, your face shines. When you speak, each small muscle on your cheek and lips works together to create a unique, vary your expression. But when the 7th cranial nerve, which controls all of these activities, is damaged, your face begins to become asymmetrical. One side of your face suddenly droops. The corners of your mouth no longer lift when you smile. When you speak, your lips cannot close properly, causing your voice to become distorted and difficult to control. Even if you say nothing, your face becomes asymmetrical. One side seems to be relaxed, emotionless, and frozen amidst the liveliness of the rest. Cranial nerve number 7, also known as the facial nerve, controls most of the facial muscles, forehead muscles, eye muscles, cheek muscles, muscles around the mouth. When damaged, due to inflammation, compression, virus, stroke, half of the face will not receive nerve signals. As a result, the facial muscles on that side no longer function normally, sagging cheeks, crooked mouth. When trying to smile or talk, the damaged side will not be able to follow, creating a distinct facial distortion. In particular, if you laugh or whistle in front of a mirror, you will clearly see this deviation on only one side. This is an important point to distinguish from central paralysis. On stroke. How to fix. Go to the doctor immediately within the first 72 hours. The golden time for treatment. Visit a neurologist or ENT specialist to determine the exact cause, peripheral paralysis, or early signs of stroke. If it is peripheral facial nerve paralysis, Bell's palsy, the doctor often prescribes corticosteroids, anti-inflammatory, reduces nerve swelling, antiviral drugs if there is a suspicion of herpes infection. Supplement B vitamins, especially B1, B6, B12, to support nerve recovery. 2. Home care and rehabilitation exercises, early facial physical therapy exercises. After 3 to 5 days of onset, gently massage the cheeks, forehead, chin every day. Practice mouth muscle movements, purse lips, smile lightly, blow bubbles, whistle. Practice in front of a mirror to see clear progress. Keep your face warm. Avoid drafts, late night bathing, air conditioning blowing directly on your face. Keep your mind relaxed. Get enough sleep. Limit stress, because stress can make the disease worse. 3. Monitor progress. Most mild cases will recover 80 to 100% within a few weeks to a few months if detected and treated early. If there is no clear improvement after 3 months, a re-examination is needed to check for deeper lesions, parotid gland tumors, neuromas, post-inflammatory sequelae, etc. Facial asymmetry, mouth distortion is not just an aesthetic problem. It is a neurological warning. And if detected early, intervention can be made during the golden time, helping to fully recover. But if ignored, you may have to live with half a smile forever. Sign 2. Eyes not closing properly. Have you noticed, every night before going to bed, we often close our eyes without thinking about it? You may think, Not closing your eyes is just a little inconvenient, but in fact, it is one of the leading risk factors leading to vision loss in people with Bell's palsy. One eye cannot close completely. Even if you try, the eyelid will still have a small gap. And when you cannot close your eyes properly, the eyes, which are the windows to the soul, start to hurt, burning, watering, easily infected, red due to dry cornea. Patients often have to use their hands to close their eyelids. Some people use medical tape to keep their eyes from drying out at night. But deeper down, it is a silent helplessness when one side of the face no longer listens to one's own commands. The 7th cranial nerve controls the orbicularis oculi muscle, the muscle responsible for closing and blinking. When paralyzed, this muscle loses its ability to contract, making the eyelids unable to close. Patients blink less or blink but not tightly, making the eyes dry, red, sore, and susceptible to corneal ulcers, a dangerous complication if not treated promptly. In particular, you can try to test by closing both eyes tightly and then opening them slowly. If one eyelid opens faster, cannot close, it is an early sign to pay attention to. When the eye cannot close completely, the cornea, the transparent layer that protects the eye, will be exposed to the air continuously, susceptible to severe dryness, scratches, inflammation, infection, corneal ulcers, causing blurred vision, fear of light, prolonged pain. Severe cases can lead to permanent loss of vision in the affected eye. In addition, the patient often has to tape the eye with medical tape when sleeping, causing discomfort and loss of aesthetics. Blinking irregularly, making communication unnatural. Prolonged insomnia, because the eye on the side that does not close makes the patient feel like eyes open while sleeping. How to fix. As soon as you notice the signs, cover the affected eye with goggles or a thin cloth when sleeping to avoid drying out the cornea. Use artificial tears, as prescribed by your doctor, to keep your eyes moist. Do not rub your eyes or let wind air conditioning blow directly into your eyes. You should see a doctor when your eyes do not close properly for 24 to 48 hours. Accompanied by other signs such as facial deviation, difficulty speaking, tongue numbness. There are signs of blurred vision, pain, or photophobia. Recovery support. The doctor may prescribe anti-inflammatory drugs, corticosteroids, antivirals, physical therapy exercises for the eye muscles, slow opening and closing, massaging the temporal area around the eye socket. In severe cases, temporary corneal protection with specialized tape or eyelid surgery, rare, may be needed. When the eyes cannot close, it is not only a sign of nerve damage, but also a reminder not to turn a blind eye to our own body. Early detection, timely treatment can protect vision, face, and most of all, peace in every blink of life. Sign 3. Difficulty speaking, weak pronunciation. Have you ever felt your own voice become unfamiliar? Some people who used to be familiar with teaching, presenting, singing, suddenly find their lips are no longer flexible. Their pronunciation is not clear. Their voice seems out of breath, slightly distorted or unusually lisping. Seemingly simple letters, like M, B, P, suddenly become difficult. When speaking quickly or at length, the patient feels that the mouth muscles cannot keep up with their thoughts, causing communication to become hesitant, awkward, and finally silent. The damage is not only in the nerves, but also gradually spreads to self-confidence, connection, and the feeling of half-living. The 7th cranial nerve controls many muscles around the mouth, playing an important role in clear pronunciation and expressiveness when speaking. When damaged, the muscles of the lips, cheeks, and chin become weak or immobile, causing pronunciation of labial consonants, M, B, P, becomes distorted. The voice is uneven, lacking strength, and may be accompanied by a slight nasal tone. Some people also lisp or swallow words, especially when tired or emotional. In addition, because of difficulty controlling the lips, patients easily drool when speaking, increasing feelings of shyness and self-consciousness. How to fix: early stage, under 72 hours, see a neurologist as soon as possible to determine the extent of facial nerve damage. Use anti-inflammatory, corticosteroid, or antiviral drugs if prescribed by your doctor. Home support: practice facial muscle recovery exercises. Purse your lips, blow gently like whistling. Read aloud the sounds ma, ba, pa every day in front of a mirror. Practice puffing your cheeks, holding your breath for a long time, and then slowly blowing out. Speak slowly, clearly each word. Avoid speaking continuously for long breaths if tired. Use a mirror when practicing speaking to observe your recovery level. Keep your mind relaxed. Don't worry, because stress can slow down nerve recovery. Social support: talk to your loved ones in advance to gain understanding and avoid avoiding communication. In long-term cases, you can ask a speech therapist to help you with pronunciation and regain your confidence. When you lose clarity in your speech, you not only lose sound, but also lose some of your ability to connect with the world. And if the signs come silently, don't suffer in silence. A slight distortion of the voice, weak pronunciation can be an early warning bell. Don't miss the opportunity to intervene. Sign 4. Drooling while eating and drinking. It's a very normal action, bringing a sip of water to your mouth, swallowing gently, then continuing your conversation at the table. But for those who are suffering from damage to the 7th cranial nerve, it becomes a confusing experience. The 7th cranial nerve controls the muscle groups around the mouth, including the orbicularis oris and cheek muscles, helping you close your mouth when chewing, swallowing, or speaking. Keep saliva in your mouth actively. This is a very obvious sign, but is often overlooked because many people think it's due to old age, weak teeth, and miss the early treatment stage. When this nerve is damaged due to inflammation, viruses, sudden cold, trauma, etc., the muscles become weak or paralyzed, leading to the mouth cannot close tightly, causing water to easily flow out when eating and drinking. Saliva accumulates in the mouth but is not clearly felt until speaking or opening the mouth. It suddenly flows out. Some people also stumble over their words. Their voice is thin, making communication even more difficult. Worryingly, this condition can last for weeks, even permanently if not treated early, and seriously affects the patient's quality of life, nutrition, and psychology. How to fix: early stage, keep your face and neck warm, especially when sleeping, traveling, or using air conditioning. Avoid eating too quickly or too much at one time. Divide your food into small pieces and drink water in small sips. Use a soft towel in your mouth when eating to reduce feelings of embarrassment and actively wipe away saliva. You should see a doctor when the condition of saliva leaking lasts a few days, accompanied by facial asymmetry, difficulty closing eyes, and slurred speech. Feeling numbness in the cheek and mouth area, or loss of control when talking. Medical support may include anti-inflammatory drugs, corticosteroids, antivirals, in the first 72 hours, the golden time of treatment. Facial muscle rehabilitation exercises, practicing mouth pursing, cheek puffing, whistling, blowing air. In long-term cases, using assistive devices or language, communication rehabilitation. For example, Mr. Robert, 72 years old, sat down to dinner with his children and grandchildren after many days of being alone. When he raised his glass of water to drink, he tilted it slightly and water spilled over the edge, wetting his chin and shirt. He quickly took a towel to wipe it off, awkwardly saying, "It must be my hand shaking." But the second time, then the third time, the water still flowed out in the same way. Everyone was silent, but he bowed his head, quietly put down his glass, and stopped drinking. From that day on, he chose to eat alone in the kitchen because he did not want anyone to witness that moment again. When eating, a simple pleasure of life, becomes something we dread, take a deeper look at the cause. Drooling while eating is not simply a matter of careless eating, but can be the first sign of a damaged nervous system. And if caught early, you can regain control and the joy of the table. Sign 5. Decreased taste on the tip of the tongue. The seventh nerve, facial nerve, not only controls the facial muscles, but also has a small branch called the tympanic nerve, responsible for the taste sensation on the front 2/3 of the tongue, especially the tip of the tongue. When the seventh nerve is damaged, due to inflammation, virus, cold, compression, the taste signal cannot be transmitted to the brain, leading to loss of taste, blandness on one side of the tongue, sometimes accompanied by numbness or dryness. Some people describe eating like chewing paper, knowing it is chewing, but no longer feeling anything. What is special is decreased taste on one side, not the whole, is a very typical sign of damage to the seventh nerve, and often appears before obvious symptoms of facial paralysis. How to fix? In the early stages, do not be subjective if you lose taste on one side of the tongue, especially if accompanied by numbness or slight pain behind the ear. Keep the face, ears, neck warm, limit exposure to cold wind fans, air conditioning. See a neurologist or ENT specialist early to determine the damage and intervene within the golden time, first 72 hours. If there are other symptoms, facial asymmetry, difficulty speaking, the doctor may prescribe anti-inflammatory drugs, corticosteroids, reduce nerve swelling, antiviral drugs, if suspected of herpes infection, physical therapy to restore facial muscle function and tongue sensation. The good news, if caught and treated early, taste can often be restored completely within weeks to months. If you notice that a familiar food suddenly loses its flavor, especially on one side of your tongue, don't assume it's bland. It could be a subtle but early sign of damage to the 7th cranial nerve. And catching it early can save you not only the taste, but also the fullness of life. Sign 6. Pain behind the ear or jaw. Many older people often complain, the pain behind the ear has been coming back these past few days, or pain down the lower jaw, like a sprained neck. But then they rub oil, take painkillers, ignore it, thinking it's due to the wind, wrong sleeping position, or old age-related degeneration. In fact, a dull pain behind the ear, especially when accompanied by facial tension, numbness in the jaw or temples, and can be the first warning that the 7th cranial nerve is sending you. And if you listen in time, you can prevent half of your face from going silent. The 7th nerve passes through a narrow section in the mastoid bone, the area behind the ear, then radiates out to branches that control the facial muscles. When there is inflammation, swelling or compression by blood vessels, small tumors, or sudden cold exposure, the area behind the ear will begin to have mild or intermittent pain. Sometimes, even before the face is distorted, the patient feels dull pain or slight pressure behind the ear on the side about to be paralyzed, feeling of tension in the lower jaw and ear, numbness or discomfort like muscle fatigue even when not doing anything. Most common causes: sudden cold exposure, night wind, late bath, air conditioning blowing directly on the face, viruses such as herpes simplex, shingles, prolonged stress, causing microvascular disorders. Less common, tumors in the parotid gland or trauma. How to fix? When first detected, keep the face, ears, neck warm, especially when sleeping or going out. Do not rub hot oil directly if you suspect the nerve is inflamed, because it can make the condition worse if it is caused by a virus. Rest, avoid stress, get enough sleep. You should see a doctor immediately if the pain lasts more than 1 to 2 days, gradually spreading to the face. There is a feeling of numbness, weakness in facial muscles, or difficulty expressing unusual mouth, eye movements, accompanied by a low fever, fatigue, unexplained weight loss. Early treatment within 72 hours with anti-inflammatory drugs, antiviral drugs, if needed, and physical therapy can result in a full recovery. Don't ignore the little pains. Sometimes, the quiet ringing in your ear is the first warning bell of a bigger injury to come. Listening and acting early can save your smile, your eyes, and your confidence. Sign 7, emotionless face, hemiplegia. The 7th cranial nerve controls all the facial muscles used to express emotions: frowning, pursing the lips, smiling, frowning, raising the cheeks. When damaged, these muscles on one side of the face are paralyzed or significantly weakened, leading to inability to frown or squint on the damaged side. When smiling, only one side is raised, the other side is completely motionless. The eyelids are wide open because they cannot close, causing the eyes to look staring, unnatural, and soulless. The person opposite can clearly feel the patient's face is divided into two unequal halves. One half is flexible, the other half is stiff. This is one of the clear signs to distinguish between facial nerve palsy, peripheral, and central palsy due to stroke, because central palsy can still wrinkle the forehead and frown. Profound psychological impact. Patients often become self-conscious, less communicative, and afraid to appear in front of relatives. Loss of expression leads to loss of emotional communication, seriously affecting the quality of life, mental health, especially in the elderly living alone. What to do if you notice that one side of your face is completely unresponsive to emotions, sadness, joy, anger, etc., etc. You need to see a doctor immediately, preferably within 72 hours of the onset. A combination of medication, physical therapy to restore facial muscles, and talking and encouraging your spirit is extremely important. The face, not just your appearance, is also the window to your soul, a place that holds emotions, memories, and even joy in life. If you see half of your face, or that of a loved one starting to go silent, don't wait. Take action. To keep the smile and the look intact before they leave without warning. Mrs. Linda, 68 years old, lives alone after her husband passed away. One afternoon, her granddaughter, Sophie, came running to show off her handmade wreath, grinning. "Grandma, I made this for you." And Mrs. Linda smiled and nodded, but little Sophie was confused. "Aren't you happy? Why aren't you smiling at all?" Linda paused. Her hand was still stroking her granddaughter's head, but a strange feeling suddenly arose in her heart. She hurried into the bathroom to look in the mirror and realized that half of her face was motionless. Her forehead did not wrinkle, her left cheek did not move, and her smile was only on one side. She looked at the mirror for a long time, then said softly, almost whispering to herself, "I am smiling, Grandma. It's just that this half of my face doesn't smile anymore." These situations seem small, but they are very real slices of the lives of the elderly. When the body starts to speak, but no one has time to listen, half of the face can no longer smile. A sip of water cannot be held in the mouth, and then from those small expressions, people start to withdraw, choose silence instead of sharing, choose to eat alone instead of gathering around the table, choose to turn their backs on the very things that once brought joy to life. If detected early, those injuries can be completely restored. And if accompanied properly, the patient will not only regain an intact face, but also regain the trust, connection, and self-esteem that has been gradually eroded. Therefore, please do not ignore the early signs. Listen to your body to keep a smile. Listen to your loved ones to preserve the most precious moments of old age. If you find this video useful, please subscribe and follow so that we can always accompany each other on the journey of caring for our health in a loving way.